Hi, I'm Candace Owens, and here is the video for Lab 1 for health assessment. And this is Melissa. She is my lab partner, and she's also in our class. So I'm going to get started. So Melissa, my name's Candace, and I'm a nurse practitioner student at Clayton State, and I just wanted to introduce myself. And today we are going to do an exam of the hair, skin, nails, head, face, and neck, ears, nose, mouth, throat, eyes, and vital signs and pain. So for the purpose of this video, because I'm in school, we are going to be recording it to submit for evaluation. So I just want to make sure that you're okay with that.
Yes.
Okay. And the video should take about 20 to 30 minutes at the most. And are you okay to proceed?
Yes.
Okay, great. So I'm just gonna I've washed my hands prior to the video, and some hand sanitizer here. And prior to starting the video, we previously took her vital signs for the sake of time. And your temperature was 97.6, which is normothermic. So for your pulse, I am just going to palpate your radial pulse for 30 seconds. Again, prior to the video, we did this. Once I palpate for 30 seconds, I'm going to multiply that by 2 to get her pulse rate. And again, we did that. Her pulse rate was 42 times 2, so it makes her pulse 84 beats per minute. Your pulse was regular and non-bounding. Your respirations, I'm going to obtain the same way. I'm going to observe the chest rise and fall for 30 seconds and then multiply that by 2. And when I did that, your respirations came out to be 15 respirations per minute. They were non-labored, and your respirations in relation to your pulse was in a 1:4 ratio, and that's within normal limits. Your blood pressure was 116/72. That's fantastic blood pressure. Systolic less than 120 and diastolic less than 80. And so, Melissa, are you in any pain today?
I'm not, no.
Okay. So if Melissa had stated that she were experiencing any pain, I would want to assess her pain using old carts, onset, location, duration, aggravating or alleviating factors. Does the pain radiate? And have you done anything to treat the pain? And I would also want her to rate her pain on a pain scale that is appropriate for her, which as an adult would be a numeric 1 through 10. Pain was 0 through 10, 0 being the no pain at all, and 10 being the worst imaginable pain. So she denies having any pain. Okay, Melissa, we are going to proceed to the exam part. So I am going to start the exam by just inspecting your head. So as I inspect your head, I'm just looking for symmetry throughout the head. I am, while I do this, I'm noting the hair patterns. I don't observe any balding patterns or signs of alopecia, and so I don't see any edema in her head. I don't notice any excessive perspiration, any major skin pigmentation. I noticed that you do have a slight bruise here, some acne scarring, and some moles that are...
I just got some PDO threads, so that's why I have some bruising.
Great!
Not being beat.
I love it. I noticed you do have a little bit of sunspot, so you spend some time in the sun. And everything looks to be okay. Now I'm going to kind of just part your hair and assess at different points, starting in the occipital or here in the front and kind of working my way back. I don't notice, like I said, any balding or alopecia noted. The hair growth patterns are consistent. Your hair, I'm kind of feeling that as I go, and that feels smooth and not brittle or dry. I'm then just going to kind of palpate the head and the scalp, noting for symmetry. I don't feel any bones that are distinguishable. I don't feel any indentations or depressions, any soft hematomas or cysts, no rashes, bumps, and the texture, and I have nice smooth skin. I'm then going to palpate the frontal sinuses, just gently. Do you have any tenderness or pain with that?
No.
Okay.
Video though.
Okay.
There you go.
And I'm just going to palpate your temporal arteries. Any pain or tenderness?
No.
Okay. I don't feel any thickness or hardness with when I palpate the temporal arteries. And so now I am going to auscultate the temporal arteries using the bell of my stethoscope. And the other side. Okay. And I don't hear any bruise when I auscultate your temporal arteries. So now I'm going to move to the nose. I'm just going to start by inspecting the nose exteriorly. It appears to be within normal size. It's very smooth. It appears midline to the face. No obvious deformities from the exterior inspection. No swelling. It looks like your nares are very even and oval, symmetrical. I'm just gonna then palpate your nose. I'm gonna start here at the ridge of your nose and just palpate the soft tissue. The nose feels firm and stable. Do you have any tenderness?
No.
Okay. There's no crepitus present or any displacement of bones or any obvious masses. Okay, Melissa, so now I'm going to assess cranial nerve 1, which is the olfactory nerve. So to do that, I'm going to have you cover one side, one nair,
Okay.
and close your eyes, and then I'm going to have you smell something. I just want you to tell me what that smell is.
Okay.
Okay?
Okay.
Okay.
Peppermint.
Okay. I'm going to have you close the other nair and identify a different smell for me.
Okay.
All right.
Cinnamon.
Okay.
2 of my favorite.
All right. Cranial nerve 1 is intact. While she was smelling the various smells, I was just noting the breathing in and out and the air passage through the nares. It was even. She did not have any increased work of breathing. It was noiseless breaths and did not appear or sound that would indicate any sort of nasal obstruction. Okay, Melissa, so now I'm going to inspect the inside of your nose using the otoscope.
Okay.
And to do that, I'm going to use my dominant hand and I'm going to insert the speculum without actually touching your septum.
Okay.
Okay, so I'm going to use my dominant hand. I'm going to use my non-dominant hand just to hold your head steady.
Okay.
So I'm just going to gently and put it in your nose again to not touch the speculum. Or I'm sorry, to not touch the septum with my speculum. All right, so the nasal passage and the mucosa is pink. It's moist. She has hair on the outside of the nose. The septum looks midline and even. No drainage, no polyps, no discharge, no bleeding. And I'm just going to use the inspect the other side with my otoscope again using my dominant hand. I'm going to just use this to kind of hold your nose and support that. Again, this septum appears midline. No signs of trauma. The mucosa looks pink and moist. No polyps observed, no cyanosis. Okay. All right, Melissa, I'm finished with the nose exam. Now I'm just gonna look, we're gonna move to your eyes.
Okay.
So I'm just gonna assess your eyes from the exterior here with my eyes. And I'm noting the hair patterns of your eyebrows, and those are symmetrical. Your eyelashes appear to be symmetrical on both sides. No hair loss in your brows or lashes. I'm just inspecting your eyelids on the top and bottom. They do appear to cover part of the iris, which is a normal finding.
Okay.
And I'm going to pull down. I'm going to look inside. I'm just going to use my pen light. And for the other side.
Mm-hmm.
The sclera appear white. The conjunctiva is clear. The iris is nice and blue. There's no ptosis present. So now I'm going to use my ophthalmoscope, and I am going to examine more of your internal eye.
Okay.
So I'm going to hold your head at about a 15-degree angle. I'm going to come in with my ophthalmoscope and examine your eye. Okay. So I'm going to use my right eye to examine your right eye, and then I will use my left eye to examine your left eye when we go to the other side. So we're going to start with the right eye.
Okay.
I'm going to come in. I'm just going to have you look straight ahead.
Okay.
All right. So I can see the red reflex. The optic disc is very sharp and well outlined with sharp borders, which indicates no congenital abnormalities of the eye, no cataracts.
Good.
All right, I'm going to go to the left side. And now I'm going to use my left eye to examine your left eye.
Okay.
Okay, so I'm just going to have you look straight ahead.
Okay.
Okay, and I am just going to brace my head here for support.
Okay.
And using my left eye, I'm going to start at about a 15-degree angle. I'm going to come in. All right. I see the red reflex. The optic disc is sharp. There's no foreign bodies, no hemorrhages, hematomas, aneurysms, and those things can be commonly found with diabetic retinopathy. I don't see any of that present, no foreign bodies. The vessels look great. Thank you. Now I am going to assess your cranial nerve 2, which is the optic nerve, and I am going to use the Snellen chart. So I'm going to stand 6 feet away,
Okay.
and I'm going to have you look at me. And to do this, I want you to cover one eye to start.
Okay.
And I want to stand 6 feet away, and I'm going to have you read as low on the chart as you can go with one eye covered for me.
Okay. So I see LTFPH.
Okay, great. And can you cover the other eye?
Uh-huh.
Okay, can you read? And so when she covers the other eye, I want to have her read as low as she can go, but maybe read it in reverse since she just did it with one eye. So I'm going to have you go ahead and do that.
Okay. HPFTL.
Okay, great. So using the Snellen chart and assessing the cranial nerve 2, which is the optic nerve, her vision is 20/20 in both eyes. Now I'm gonna check your visual fields. So to do that, I'm gonna have you cover one eye.
Okay.
And to do this, whenever I introduce my hand into your visual field, I want you to let me know when you see it. You can just say now.
Okay.
And this is to assess for peripheral vision.
Okay.
Okay?
Okay. Now. Now. Now.
Okay. I'm going to have you cover the other eye.
Now. Now. Now.
Okay, great. I'm also going to have you... I'm going to check for cranial nerves 3, 4, and 6, which is oculomotor, trochlear, and abducens. And to do that, we are going to have you look straight ahead at me. Just look at my nose.
Okay.
And I'm going to move my finger, and I want you to follow my finger.
Okay.
Okay? So I'm going to start here. I'm going to support your chin. And I just want you to follow my finger with both of your eyes.
Okay.
Okay. So I'm gonna move my finger to 1 on a clock, 3 on a clock, 5, 7, 9, and 11. Okay. So your eye movement was coordinated and smooth. There was no nystagmus noted. And Melissa, just one more thing. I just want to check for convergence.
Okay.
And so I'm going to have you look at my finger, and I'm going to move it closer to your nose, and I want you to continue to watch my finger.
Okay.
Okay. Good job. Good job. So that's just checking for convergence. And I'm going to do the cover-uncover test, which you would need to do if your corneal reflexes were impaired. So, Melissa, to do that, I'm going to have you cover one eye, and I'm going to have you look at my finger.
Okay.
And I'm going to have you look at my finger.
Okay.
And then uncover the eye. Okay, great. And I'm going to have you do it to the other side. Okay, and so for that, I'm just checking to see if the eye that is covered can keep up with the eye that's not covered. And so then we're just checking for conjugate gaze. All right, Melissa, one more for the eye. I'm going to have you to cover one eye again.
Okay.
And then I'm going to shine a light in your eye,
Okay.
and then I'm going to ask you to uncover. And so I'm checking for direct and indirect pupillary response. So I'm going to shine my pen light in your eye. Now uncover. Great. And the other eye. And great. So both direct and indirect exposure to the pen light has symmetrical pupillary response to light. And both pupils reacted appropriately. Okay, Melissa, I'm now that concludes our eye portion. I'm now ready to move to your mouth.
Okay.
So when I assess your mouth, I'm just gonna start start with looking at the mouth exterior at rest, and so I can note that her smile is symmetrical, her lips are pink and moist, and so then I'm going to have her smile and bite down with your teeth. Okay, so I don't observe any sort of malocclusions, overbite or underbite. This is also testing cranial nerve 5, which is the trigeminal nerve. I'm just going to have you open again, and I'm looking at your teeth. Your teeth are nice and ivory, white. I'm going to have you, I'm going to put some gloves on. I'm just going to have you open your mouth for me.
Okay.
And I'm just going to inspect the inside of your mouth. I'm going to use my pen light. So I'm just looking at your teeth on the inside. Take really nice teeth. I don't see any signs of dental caries, no missing teeth, or masses, lesions present on the inside of your mouth. All right, Melissa, I'm just going to have you smile real big. Okay, I'm going to have you blink and raise your eyebrows real big. And can you put air up in your, okay. Great, so that's cranial nerve 7, which is the facial nerve. It appears intact. I'm now going to palpate the inside of the mouth. I'm gonna have you open for me. I'm just gonna palpate around your soft palate, your gingiva, and look at your hard palate. Have you stick your tongue out for me and say, ah. I'm just noting the tonsils. They are a little swollen, like a +1. There's no exudate present, no postnasal drainage. The tongue appears symmetrical on both sides. Can you stick your tongue out for me? Mm-hmm. And can you move it side to side? All right, so that is cranial nerve 12, which is the hypoglossal. And the tongue is symmetrical in strength and moves to both sides evenly, and that's a normal finding. Done with that. Okay. All right. So I think we're done with the mouth. Okay, Melissa, now we're going to actually, okay, so when you say ah, can you do that? Okay, so you said ah, and so that's glossopharyngeal cranial nerve 9. And again, when we, can you say ah again? I noticed the uvula is moving, it's rising and falling evenly, and it looks symmetrical on both sides. It's midline, and the symmetry of the upper palate is symmetrical on both sides. And that's cranial nerve 9. Cranial nerve 10 is the vagus nerve, and to assess for cranial nerve 10, we would want to check the patient's gag reflex. I'm actually not going to make Melissa gag today, but to do that, I would just have her open up, stick her tongue out, say ah, and then I would touch the posterior pharynx to assess for a gag reflex. I am not going to make Melissa gag today because we're at my house and I have to clean it up.
Yeah.
Okay, Melissa, that's it for the mouth. So now I am going to move to the ears. So I am going to inspect your ears. I'm going to inspect the arcal and the mastoid area, and they look symmetrical on both sides. I do see that you have a small hole from ear piercing. The mastoid area does not look swollen, and so now I'm just going to palpate in the mastoid area for tenderness. Do you have any tenderness, Melissa, with that?
I don't know. Actually, kind of feels good.
And I'm just going to palpate the arcal. It should be firm and very movable. I don't see any deformities, mole cysts. I'm just noting that the arcal on your ears appears to be horizontal with the nasal, the bridge of your nose, and so that is a normal horizontal plane that your auricle should be in alignment with, which it can, you know, some congenital chromosome abnormalities can have low set ears, so her ears are within a normal height on her head. All right. Again, the auricle's firm, movable, no masses, lesions, cysts, or rashes. I'm also looking in the ear, into the external ear canal. I do not see any drainage. So let me look on this side, the external ear canal. Don't see any drainage. Okay, so now I'm going to examine the interior of her ear with an otoscope. Okay, Melissa, so I'm just going to use, I'm going to assess the right side. I'm going to use my right hand.
Okay.
And so I'm going to pull down and back on the auricle and gently insert the otoscope to about 1 to 1.5 centimeters, which is about 1/2 of an inch, into the ear canal. All right, so I'm just inspecting the ear canal. I see a small amount of earwax. There are some fine hairs on the outer surface of the ear canal. I see the tympanic membrane. It's translucent and gray. The tympanic membrane is moving in and out, which is a normal finding. I can see the incus located behind the tympanic membrane. And this is the right ear, and the cone of light is at 5 o'clock. And the ear canal is pink to white. No lesions or trauma, signs of trauma noted. All right, Melissa, I'm just going to assess the left ear. So to do that, I'm going to use my left hand. I'm going to use my right hand to and stand on the patient's left side. I'm going to use my right hand to pull down and back on the auricle of the ear while I again insert my otoscope to approximately 1/2 inch or 1.5 centimeters. Okay, Melissa. All right, so I note the ear canal. There's a small amount of earwax, some fine hairs on the outside third of the ear canal. I see the tympanic membrane. It is, again, translucent and gray. It doesn't appear to have any fluid. It's not bulging. This is your left ear. The cone of light is located at 7 o'clock. The tympanic membrane is moving in and out. Okay. Concludes that. So your ears look great. There's no perforation. The tympanic membrane is normal. There's no abnormal findings such as fluid, trauma to the ear, or anything that I see when I'm doing the internal ear examination. I want to now assess cranial nerve 8, which is vestibular cochlear. So Melissa, to do that, I'm just going to have you cover one ear for me.
Okay.
I'm going to say a word, and I'm sorry, you don't have to cover it. I'm going to have you cover one ear. I'm going to whisper a word and do the whisper test, and I want you to tell me what word I'm saying.
Okay.
Okay? Now you can go ahead and cover one ear.
Okay. Skull.
Okay.
Wedding.
All right. We're in school and Melissa is getting married, so that's why I chose those words. So her whisper test was normal, and again, that assessed cranial nerve 8. I'm now going to use a tuning fork, and I'm going to do the Weber test, where I'm going to strike a tuning fork and then stick it on the middle of her head. And Melissa, when I do this, and I'm going to stick it right here, and I want you to tell me if you hear the vibration the same in both ears or if one ear is different, okay?
Okay. It's the same.
Okay, so this is the Weber test, and what that means, she hears it the same in both ears, so there's no lateralization. So hearing is equal on both sides. So Melissa, now I'm going to do another test called the Rhine test, and I'm going to strike the tuning fork. I'm then going to place it on your mastoid bone here, and when you can no longer hear it, I want you to say now.
Okay.
And then I'm going to move it to the front of the ear, and then when you can no longer hear it, I want you to tell me now. Okay?
Sounds good.
So 2 steps.
Okay. Now. Now.
Okay, great. And we're going to do the other side.
Now. Now.
Okay, great. So with this test, we're testing air conduction versus bone conduction, and air conduction should be greater than bone conduction in approximately a 2-to-1 ratio. So that would mean that you have a positive Rhine. So Melissa, you have a positive Rhine, which means that your air conduction is greater than your bone conduction, and that is a normal finding.
Okay. Good to hear.
Okay.
So far, I'm pretty normal.
As far as we can tell. All right. Okay, Melissa, so now I'm ready to move to the neck.
Okay.
So I'm just going to start by inspecting your neck.
Okay.
I'm looking at your neck. I do not see, when I'm inspecting your neck, I'm looking for darker pigmentation. I'm looking for rash lesions. I'm looking at both sides, all the way around. I don't see anything, it looks symmetrical. I'm just going to start, now that I've inspected the neck, I'm now going to palpate the neck. And just for any tenderness. While I'm palpating the neck, I'm also going to palpate her lymph nodes. So with that, I am going to start with the submental. Here, just below the chin. And Melissa, I'm just going to have you look this way a little bit so I can get you on video. And I'm going to palpate the submandibular lymph nodes. And then the cervical lymph nodes. Melissa, do you have any tenderness when I palpate?
I don't know.
Okay. All right. So her lymph nodes are, they're not enlarged, they're not tender, they're not warm, and they are movable and palpable. So I'm now going to palpate your trachea. And to do that, I'm just going to put a thumb on each side. All right. You can feel the tracheal rings. Whenever I'm palpating her tracheal, I do not feel a tracheal tug, which could be a sign of an aneurysm. So I do not feel a tracheal tug. I am also going to palpate the space between her trachea and the sternocleidomastoid. And I'm going to do that on both sides. So the space between the trachea and the sternocleidomastoid on both sides appear to be the same and normal. Okay, Melissa, I'm going to check now the range of motion for your neck. So if I can get you to look up for me, and that's hyperextension. I'm going to get you to flex. Okay, look back to the front. Okay, now I'm going to have you turn your look towards the left and look towards the right. Now I'm going to have you put your left ear on your left shoulder and your right ear on your right shoulder.
Sorry, I did that opposite.
That's okay. All right, so she has good range of motion with flexion, extension, rotation, and lateral movements. Melissa, do you have any dizziness or pain with any of those movements? Okay,
No.
The movements were smooth and coordinated. I did not notice any torticollis present, which would be in the sternocleidomastoid area. I'm now going to assess cranial nerve 11, which is a spinal accessory muscle. So to do that, I'm going to first stand in front of the patient. Melissa, can you shrug your shoulders for me, please?
Mm-hmm.
Okay. And I'm going to stand behind the patient and ask her to shrug her shoulders as well. So I'm just noting the strength of her trapezius, which is symmetrical bilaterally. And when she lifts from the back, I'm just noticing any kind of contour or hollowing or displacement and winging of her scapula. Just have you do it one more time. All right, I don't observe any winging or displacement of her scapula and her shoulders from posteriorly. And again, there's no torticollis present on either side. Her neck is midline and her face is midline. Now, I have already palpated the neck. I'm now going to palpate the thyroid gland. Okay, Melissa, so to palpate the thyroid gland, I'm gonna give you some water. All right, and I'm gonna stand behind you and I'm just gonna gently palpate your thyroid gland. And can I have you take a sip of water and just slightly look up and swallow for me? All right, when you swallow, I do feel the thyroid gland rise and fall, which is normal. All right, Melissa, so I'm still gonna be palpating on your thyroid. So to assess the right side of your thyroid, I'm going to push the thyroid to the right side and have you slightly look to the right side. Okay, Melissa, now I'm going to have you look slightly to the left side. Okay. All right, when I palpate, I do not feel any nodules. The lobes of the thyroid are smooth. It rises when you swallow. It's very firm but palpable. There's no enlargement. And I just want to make note that the right side of the thyroid is a smidge larger than the left thyroid. And Melissa, that's a normal finding.
Okay.
So lastly, I'm just going to auscultate your thyroid. And to do that, I'm just going to use, once again, the bell of my stethoscope. I'm just going to place it gently here on the thyroid. And I'm auscultating, I'm listening for any bruise. Right, and I do not hear any bruise when I auscultate your thyroid, so that's a normal finding. And the last thing we're going to do today, Melissa, is I am going to assess your nails. So I'm just going to inspect your nails. I'm going to look at all your fingers, make sure that bilaterally there's no yellowing, color is good, they're pink, the nail beds are pink to a white. No signs of any fungal infections with yellowing of the nails or brittle. Now I'm just going to palpate the nails. I'm also looking, when I inspect her nails, I'm looking for clubbing. There's no clubbing of the fingers or cyanosis of the nail beds. That could be signs of hypoxia. And now I'm just going to palpate her nail beds, and they're very hard. And no ridges, no pitting with palpation. All right, Melissa, I think I'm done with your exam. Thank you for being my test subject today.
Yes,
and
great.
Thank you. I think we're done.